This program is brought to you by Stanford Hospital and Clinics.
One of the things that does tend to be true about allergic reactions is they tend to happen very rapidly after the exposure to the food or the substance that you're allergic to. And they do tend to be pretty reliable. So if you reacted to the peanut one time, you're going to react to it the next time. And you're not going to have some peanut butter you can eat and some peanut butter you can't eat. And of course, if the symptoms are consistent with an allergy too, for example, you have hives, or you have vomiting, diarrhea, wheezing, those kinds of things are all characteristic of allergies. But in general, it's better to let us help you figure that out, and so that you don't make mistakes about what kinds of foods you can really give your children, and don't unnecessarily restrict your children from foods that they actually could eat without a problem. If you were worried about a significant kind of allergic reaction, you don't want to give a challenge on your own. I wouldn't just try and give them the food again and see what happens. What I would do is I would go and have the child evaluated by an allergist, and that's really our job, is to help you figure out whether those kinds of reactions really are allergic or not. Don't try this at home. In general, when people have have a true allergic reaction, it tends to be kind of stereotyped. The reaction that you have one time will be the reaction that you have a second time, but that's not always the case. So it is important to be careful about that, and that's one of the reasons that you don't want to kind of challenge yourself, because if you challenge yourself and something bad happens, you're not in a place where you can get treatment. Most kids, even kids who have a lot of different food allergies, will outgrow most of those allergies over time. There are a few allergies that some kids tend to keep through their lives, such as peanut and tree nut allergies, fish, shellfish. But those things, even of those kinds of allergies, about 20–25% of kids will ultimately outgrow. So in general, it is important to keep a relationship with the allergist and to follow your kids over time, and to check periodically to see if they are able to tolerate the food now. So in general, anyone should be tested if they have a suspicion about whether a symptom that they're having is related to an allergy. So when we follow kids and check kids to see whether they've outgrown their food allergies, we do it by testing them to see whether the IgE level has fallen enough to give them a challenge. And when we give them a challenge, we give them a challenge in the office where it's safe and we can manage any bad reactions that might occur. It is important to look at the testing carefully and to correlate the testing with the kinds of symptoms that you're actually having, and to interpret them very carefully, because in particular food allergy testing can have a lot of false positives and a lot of some false negatives as well. So the nasal steroids and inhaled steroids for children, and in particular for kids with asthma, they actually play a very critical role in controlling the asthma, which of course can be a fatal disease. We do want to be careful how we use them, but at the same time, they are generally very safe medicines. They're very different than the steroids you would take by mouth, which have a large number of potential side effects. And in fact, the main reason they were developed was to avoid those, the inhaled steroids were developed was to avoid those kind of side effects. The steroids are designed so that when you inhale them, any that you do swallow or absorb gets inactivated by your liver very quickly. And so you really get very little in the way of any kind of systemic effect throughout your body. So those nasal steroids are safe to use. The only side effect that people sometimes see is that if you're using a fairly high dose, kids' growth can occasionally slow down a little bit, but they ultimately catch up by the time they're an adult, and so they reach their predicted adult height in the end anyway. And it's much more important to have your asthma under control than to worry about what ends up amounting to approximately 1.5 centimeters of potential height change, which is less than ½ inch.